Hi again, it's Dr. Ethan Colliver. I'm a physician at Valley Sports and Spine Clinic. I'm also the clinical director at Valley Active. With me as always,
Dave Cicchini, rehab specialist.
And today we're going to expand a little more on serratus anterior strengthening. To get a little more anatomy, I want you to look at the last video and see its origin and its insertion a little better. But briefly, it starts underneath the shoulder blade and inserts onto the first 8 or 9 ribs, really along the midline here. And when it's not working right, you can get a lot of shoulder pain and neck pain. When it's not working right, we'll see a lot of muscles start to do the work of the serratus anterior to try and struggle to move the arm around. The upper trap and the levator will oftentimes be overactive, but also the anterior deltoid is a big culprit. The clavicular portion of the pec major and even subclavius muscle will be very tight and really not allow the shoulder to protract very well. You'll see inhibition as well of the chest portion of the pec major when you have a lot of serratus anterior dysfunction. Dave's going to demonstrate us an exercise to strengthen it, a little different than last week. He's put an elastic band for resistance around it, but you don't have to do that. And he's going to protract his shoulder. And you see my fingers getting close together. Now let's retract the shoulder. And he's going to go again. And he's bringing the edge of the shoulder blade closer to these fingers. And you can feel the serratus just underneath my fingers turning on great. His upper trap is quiet. You know, he's holding his arm up, so his anterior delt's a little on, but I'm okay with that. Clavicular portion of pec's not too overactive. So that looks good. Dave, do you have any neck pain or shoulder pain with that?
No, sir.
Good. You could do that maybe 5 to 10 times in a row. Maybe do a couple sets of that. If you're having increased neck pain, shoulder pain, or even arm pain, stop and talk to your healthcare provider. And thanks. Good luck.